Doing really well here, Neil. And you?
Fantastic in today's topic. Are you a candidate for a cesarean section? In general, who might be a candidate for a C-section?
Any woman who has, if there's concern about the mother's health or the baby's health, in other words, if labor and delivery pose a risk to either mother or baby, that's a time to consider having a C-section. The other option or problem is if vaginal birth is just not possible, like for some women who maybe have broken their pelvis and it doesn't have the typical female shape anymore.
What are some specific reasons for having a C-section site?
Well, some reasons for a cesarean section include medical conditions, complications during labor, a failure to progress in labor, fetal distress, abnormal fetal positioning, or a repeat C-section.
What are some chronic health conditions that would be reasons for a C-section?
These include high blood pressure, diabetes, um, and there are three kinds. There's gestational, type 1, and type 2. Certain infections, including HIV and genital herpes, kidney disease, heart disease. They're all conditions which might make vaginal birth risky.
What is an abnormal fetal heart rate?
There are many different kinds of it, but if you're looking at the dangerous kind of fetal heart rate, you're looking at what we call late decelerations. And late decelerations occur, they are fetal heart rate dropping after the contraction.
Can a fetal heart rate monitor be misleading?
Yes, very misleading. We thought that there's going to be a great big benefit for doing fetal heart rate monitoring. And these actually started in 1950, so they've been around for 75 years.
What is malpresentation?
Malpresentation is when there's not a head first. For example, there are several kinds of breaches, but a transverse lie has the buttocks over here and the head over here. That will never deliver. Another kind situation which delivery cannot occur is a shoulder presentation. With both of those, there is a time when you have the option of turning the baby into a normal head first presentation. Then there's breaches. There's a lot of people, doctors, who are afraid of breaches. We're not supposed to deliver a footling breech, which is 2 feet down. We're not supposed to deliver anything except butt down and feet up. And even then, a lot of doctors are worried about it. So,
Is a prolapsed umbilical cord a reason to do a C-section?
a prolapsed umbilical cord is generally recognized as a reason to do a cesarean section. I have, on occasion, delivered babies with the cord prolapsed vaginally without any trouble at all. You just watch the baby's heart rate and you watch the cord, and as long as it's pulsating, it's really not a problem. But if I said that in my examination, I'd get an F. So watch out for that.
Are multiple gestations a reason to do a C-section?
Yes and no. There's a lot of people who don't want to do twins vaginally. In my first practice, I had 4 batches of twins in the first 6 months, and none of them were delivered vaginally. The old doctors used to say feet make nice handles, and indeed they do. So the most common presentation with twins is head first. The first one is head first. And the second one doesn't really matter which way it is. But since the cervix is all dilated, just reaching up and grabbing a couple feet, just pull the baby out. That it works out quite well. Again, if I gave that answer on the test, I'd probably get an F, but it does work out really well.
Can you deliver triplets vaginally?
We're not supposed to, and I never have. I do know a lady who does home births, and she's delivered two batches of triplets vaginally. So, there's loads and loads of problems with that. And of course, if you deliver these babies in the hospital, you have three batches of neonatologists and you have all kinds of equipment. So doing these deliveries at home is really high risk. But she's been lucky and all the babies have lived, and only one baby had to go to the hospital.
Can you deliver a baby with placenta previa vaginally?
Years ago, that was the way it worked. When deliveries occurred at home, you there were many moms who delivered vaginally, a baby vaginally with the placenta previa. Now, that being said, there are three kinds of placenta previas. There's a marginal, which is when the placenta is close to the cervix. And I think that what happens then is that baby's head actually tamponades or shuts off the blood supply to that part of the placenta. Today, of course, those deliveries would be done in the hospital and they'd be done with cesarean section. If you have a placenta that completely covers the cervix, that is not a deliverable presentation. So that will need a cesarean section.
What is a placental abruption?
Abruption means to let go. So there, you can have an abruption. We think in terms of an abruption as being an emergency situation, but in my experience, most often they haven't been emergencies. They start sometimes as early as 27 weeks. I put them in the hospital, especially if they lived, like 80 miles away, because you never know for sure when heavy bleeding is going to start. I've never lost a mother or a baby, and I think I might have given one transfusion. So there's a lot of warning, and these things are totally manageable.
Is a previous C-section a reason to have a repeat C-section?
Well, I don't think so. I've been doing VBACs, that is vaginal birth after C-sections, for many years. I started in 1978, so a long time ago.
What is
Anyway,
fetal? Okay, yes, sir. Go.
that's okay. Go ahead. Fetal macrosomia.
Well, yeah. What is fetal macrosomia?
Macrosomia is a big word for a big baby, and they're too large to pass through the pelvis. So a C-section might be considered then. So the problem isn't necessarily the absolute weight of the baby, it's why is the baby big? And that is moms who have diabetes in pregnancy often have shoulder babies with big shoulders and they get hung up. And so you have a shoulder dystocia, which is a real emergency and it scares the liver out of most people who are attending that.
What is weight? What weight is considered macrosomia?
4,000 grams is considered macrosomic. And in that 4,000 grams translates into 8 pounds and 13 ounces, which isn't, I think, actually all that big. But according to what I could read on this topic, the average weight for the average baby is 7 pounds. And one of the problems that we have when we guess weight, we tend to guess toward the mean. That is, we think that the small baby is bigger than it is. We think that the big baby is smaller than it is. So there's a lot of complications that go with estimating weight. And sometimes there are people who think that ultrasound is a good answer. Not sure that it's a lot better than the obstetrician's guess.
All right, best place to go is world.allen.com and pick up Pregnancy Your Way, available today on Amazon.